Review of Systems, ROS, and Exam Diagnosis Support. Today's tip is all about the review of systems and exam diagnosis support. The review of systems, ROS, is dictated by the chief complaint, which is the main reason for a patient's visit. The patient's history of present illness may be referenced in the appropriate sections in the ROS. However, all documentation must be complete and specifically based on a face-to-face encounter with the patient. It is not enough to just look at test results or a patient's medical history to make a diagnosis determination. Most diagnoses should be addressed in the exam with findings that support them, either positive or negative. The exam is broken down to reflect your findings, what you see, hear, feel, and assess. Whatever symptoms led to your diagnosis must be reflected in the exam. All assessments are included in the exam, including diagnostics, the PHQ-9, drug and alcohol assessments, mini-nutritional assessments, and all others. If the diagnosis is stable or getting better on current treatment, you may have a negative exam finding. Even if the patient is complaining of specific symptoms, the actual findings on the exam may be negative. You must address this in your exam and explain the reason for the negative findings in your impression and plan. If there are issues needing treatment, they should be documented in the impression and plan and cannot be listed as within normal limits in the exam without an explanation. Here are some examples. If you are documenting a skin rash, purpura, or pressure ulcer, the exam portion for the skin cannot be within normal limits. It should describe the skin issue. If there are diagnostic results, refer to them in the INP. If the patient is depressed on the PHQ-9, then the exam must reflect it too. If you are discussing malnutrition in the INP, then the exam should support muscle wasting, fatigue, weakness, poor skin turgor, as well as abnormal labs. To put it simply, document everything properly and thoroughly. Avoid conflicting or missing information in your progress notes. Contraindications and missing information will lead to lost HCCs. Remember to always say what you see. I'm Dr. Tharp, and this has been your MRA Tip of the Day.